Many men do not realize how much their urinary symptoms have quietly taken over their lives until the problem becomes impossible to ignore. At first, it may seem minor, a weaker stream, a little hesitation before urine starts, a sense that the bladder is not quite empty even after standing there longer than usual. Then the pattern grows. The bathroom becomes the first thing you look for in a restaurant, on a road trip, or in a store. Sleep gets interrupted once, then twice, then several times a night. A man who used to sit through a movie or a long meeting without a second thought begins planning his life around the nearest toilet. For some, there is embarrassment. For others, it is frustration. And for many, it becomes a quiet form of suffering they simply accept as part of aging. But while urinary symptoms do become more common with age, they should never be dismissed as something you just have to live with forever. One of the most frequent causes of these problems is benign prostatic hyperplasia, often called BPH, which simply means enlargement of the prostate that is not cancer. This condition is extraordinarily common. By later adulthood, it affects a very large percentage of men, and because men often age gradually into the symptoms, they may normalize something that is actually significantly reducing their quality of life. The prostate sits just below the bladder and wraps around the urethra, which is the tube that carries urine out of the body. That location is important because when the prostate grows, it can begin to narrow the urinary channel. Imagine placing pressure around a garden hose. Water may still come through, but the stream becomes weaker, slower, and less efficient. The bladder then has to work harder to push urine out. Over time, that can create a whole set of symptoms that go far beyond a weak stream. Some men notice mostly storage symptoms. They urinate often, feel urgent pressure to go, or wake up repeatedly at night. Others notice more emptying symptoms. They have to push or strain, wait for urine to start, or feel like they are never really done. Some men dribble afterward. Others find that when they finally need to go, they barely make it in time. These symptoms may sound small to someone who has never experienced them, but for the person living with them every day, they can be exhausting. Broken sleep alone can affect mood, memory, concentration, blood pressure, and overall health. A man who wakes up 3 or 4 times a night to urinate is not simply inconvenienced. He is slowly being worn down. I often think about the patient who tells me he has stopped taking long drives because he is afraid of being stuck in traffic. Or the one who sits near the aisle in every meeting because he knows he will have to get up. Or the man who says he no longer sleeps in the same bed as his partner because he is in and out of the bathroom so often that he does not want to wake her. These are not dramatic stories in the way people usually think of illness, but they are deeply disruptive. They change how someone moves through the world. They chip away at confidence and comfort. They make men feel older than they are. And then there are the men who do not just have annoying symptoms, but have moved into more serious territory. Some begin getting repeated urinary tract infections because the bladder is not emptying well. Some see blood in the urine because the enlarged prostate has developed fragile blood vessels that bleed. Some cannot urinate at all and end up in the emergency room with severe retention and a catheter placed into the bladder to drain it. Others develop pressure that backs up toward the kidneys, threatening kidney function over time. At that point, the issue is no longer just quality of life. It is a medical problem that deserves prompt and thoughtful treatment. The good news is that we now have more options than ever before. That is both reassuring and sometimes confusing. Years ago, the conversation about an enlarged prostate was often more straightforward. Men either lived with symptoms, tried medication, or underwent a more traditional operation. Now, there are office procedures, minimally invasive treatments, laser approaches, robotic surgeries, and catheter-based treatments done by other specialists. This is progress, but it also means that men are often handed a menu of choices without necessarily understanding how different those choices really are. That confusion is understandable. A man may hear terms like steam therapy, implants, water jet treatment, embolization, laser vaporization, enucleation, robotic surgery, and resection, and have no idea how to compare them. Which one works best? Which one lasts the longest? Which one is safest if you are older or on blood thinners? Which one preserves ejaculation? Which one requires a catheter? Which one gets you back to work the fastest? These are not superficial questions. They are exactly the questions that matter when someone is deciding what to do with his own body. Because the truth is that choosing a treatment for BPH is not just about making the prostate smaller. It is about deciding what matters most to the individual man sitting in front of you. For one person, the priority may be to avoid a hospital stay. For another, It may be preserving ejaculation. For someone else, it may be choosing the most durable option possible because he never wants to deal with the problem again. Another man may have so many medical conditions that anesthesia itself becomes part of the decision. Some men are willing to accept a longer recovery if it means a stronger and more permanent result. Others want the lightest touch option available, even if there is a chance they might need another procedure later. This is where medicine works best when it becomes personal rather than generic. A treatment that is perfect for one man may be the wrong choice for another. A relatively small prostate may be suited for one kind of procedure, while a very large gland may push the decision in an entirely different direction. The way the prostate is shaped also matters. Some prostates grow in a way that bulges up into the bladder like a ball valve, creating a particularly troublesome kind of blockage. A man may not know he has this unless someone has actually looked inside with a camera or studied the anatomy carefully on imaging. That kind of detail can completely change which procedures are likely to work well. Sexual function also matters far more than many people realize. Most men asking about BPH surgery have already thought about urination, catheters, anesthesia, bleeding, and recovery. But many have not been told clearly that one of the most common side effects of more definitive prostate procedures is retrograde ejaculation, where semen goes backward into the bladder instead of out through the penis. This does not stop orgasm, and it is not dangerous, but it can feel like a major loss to some men. Others are not bothered by it at all. The point is not that one reaction is right and the other is wrong. The point is that it must be part of an honest conversation before any procedure takes place. In the same way, fear about erections often comes up, and understandably so. Men hear the word surgery and assume anything done near the prostate must put erections at risk. In reality, the nerves responsible for erections are usually not the main structures being targeted during these procedures, especially surgery specifically for BPH rather than cancer. That does not mean sexual changes never happen, but it does mean the situation is more nuanced than many men fear. So before anyone gets lost in the names of procedures and the alphabet soup of medical terms, it helps to begin in the right place. This condition is common, treatable, and highly individual. You are not weak for being bothered by it. You are not overreacting because nighttime urination is ruining your sleep or because your bladder symptoms are controlling your day. And you are not limited to just one path forward. In the next chapter, we will go deeper into how doctors think about treatment choices, what kinds of surgical and minimally invasive options exist, and why the best procedure is often not the newest or the most advertised one, but the one that fits the person, the prostate, and the life being lived around it. Once symptoms become disruptive enough that medication is no longer helping, not tolerated, or no longer desired, the conversation shifts from management to intervention. This is where many men begin to feel overwhelmed. They have often spent months or years trying to cope. Some have already been through several medications, adjusting doses and balancing side effects like dizziness, low blood pressure, fatigue, or sexual changes. Others simply do not want to commit to daily medication for the rest of their lives. And then there are the men for whom surgery is no longer optional in a practical sense because the bladder is not emptying, infections keep happening, bleeding keeps recurring, or the kidneys are starting to feel the consequences of long-standing obstruction. At that point, the question is no longer whether something should be done, but what should be done. And to answer that well, a doctor has to understand more than just symptoms. Prostate size matters. Prostate shape matters. The patient's age, heart and lung health, blood thinner use, recovery goals, and sexual priorities all matter. Even the bladder itself matters because not every man with urinary symptoms has only a prostate problem. Sometimes the bladder has been overworked for so long that it becomes weak, irritable, or both. In those cases, opening the channel may help, but not always as dramatically as expected. That is why a thoughtful workup is so important before choosing a procedure. Some men come in already knowing they have a large prostate because they have had imaging, an ultrasound, or prior evaluation. Others only know they urinate badly and assume the answer is simple. Often we can estimate the problem through a combination of symptom history, prostate measurements, urine flow testing, and office evaluation. Sometimes a cystoscopy, where a small camera is used to look inside the urethra and bladder, becomes especially helpful. It can show whether the prostate is pushing into the channel, whether there is a median lobe projecting into the bladder, and whether there are bladder changes that suggest long-standing blockage. In more complex cases, specialized bladder pressure testing may also help determine whether the bladder itself is weak, because that can influence how much improvement someone should realistically expect after surgery. With that background, treatment choices begin to make more sense. The least invasive group includes what many people now call minimally invasive therapies. These are attractive because they tend to involve less bleeding, shorter recovery, and in some cases an office-based approach. But the trade-off is often that they may not be as durable as the more traditional operations, especially in larger or more complicated prostates. One of the better known options uses steam to treat the prostate. In this approach, a scope is passed through the urethra and short bursts of water vapor are delivered into the enlarged tissue. The heat damages targeted prostate cells, and over time the body gradually absorbs that tissue. The idea is elegant because there is no cutting and no major incision. For the right patient, especially someone with a smaller to moderate sized prostate who wants a less invasive option and cares deeply about preserving ejaculation, this can be an excellent choice. The challenge is that improvement is not immediate. In fact, men often feel worse before they feel better. Swelling and irritation can temporarily increase urgency, frequency, and discomfort. A catheter is usually needed for a few days, and full benefit may take weeks to months, sometimes longer than patients expect. This is one of those procedures where setting expectations beforehand is almost as important as the procedure itself. Another minimally invasive option mechanically opens the urinary channel using small implants that pull prostate tissue out of the way. Instead of removing tissue, it creates a wider passage by retracting it. This can be appealing because recovery is usually faster, ejaculation is typically preserved, and some men may avoid a catheter altogether or need one only briefly. It can work very well in carefully selected men, particularly those with smaller glands and favorable anatomy. But not every prostate is built for it, and some men develop irritation or discomfort from the implants themselves. Over time, a meaningful percentage of patients will need additional treatment. So it is less about permanently solving the problem and more about getting relief with a lighter touch approach. There are also newer approaches designed to reshape or widen the prostatic urethra without major tissue removal. Some use temporary devices placed in the urethra for several days to remodel the obstructing tissue. Others use balloons and drug-coated technology to open the channel and reduce scar reformation. These options are promising and innovative, especially for carefully selected men with smaller glands, but they come with one major limitation that patients deserve to hear clearly. The long-term data are still evolving. Early results may be encouraging, but medicine looks different when something works at 1 year versus 5 years versus 10 years. For a man in his late 50s or early 60s, that durability question matters. At the more established end of the spectrum sits aquablation, which uses a precisely directed high-pressure water jet under imaging guidance to remove prostate tissue. It is more invasive than office procedures and usually requires anesthesia, but it can be highly efficient and is especially attractive for larger prostates. One of the interesting features of this option is that it may preserve ejaculation more often than some of the classic surgeries, though not in every man. The recovery is still surgical, meaning a catheter is expected and bleeding remains a real consideration, but it offers a middle ground between minimally invasive treatment and traditional resection. Then there is prostate artery embolization, which comes from a different philosophy altogether. Instead of approaching the prostate through the urinary channel, an interventional radiologist reaches it through the blood vessels and blocks off part of its blood supply so the gland shrinks over time. This can be an excellent choice for selected men, especially those who are poor candidates for anesthesia or surgery, or who strongly want to avoid procedures involving tissue resection through the urethra. Sexual side effects are generally minimal, and recovery is often relatively quick. Still, symptom relief tends to be less dramatic than with the most effective surgeries, and retreatment rates are higher. This is not necessarily a weakness if it fits the patient's goals, but it is something men should understand. Less invasive often means less disruptive, but it may also mean less durable. Moving into the traditional surgical category, the classic transurethral resection of the prostate, often called TURP, remains one of the most time-tested operations in urology. In this procedure, prostate tissue is removed piece by piece using a scope pass through the urethra. It has lasted for decades as a standard because it works. Relief is typically reliable and noticeable. Men often feel a real improvement in stream and emptying relatively quickly, especially compared with some of the slower acting minimally invasive options. But it is still surgery. It requires anesthesia, typically involves a catheter for a short time, and comes with a meaningful likelihood of retrograde ejaculation. Bleeding is possible, though serious complications are less common in experienced hands. Its major strength is durability. When done well, it can provide long-lasting relief for many years. Laser procedures occupy an important space in modern BPH treatment as well. Some vaporize tissue, while others peel out the enlarged, obstructing portion of the prostate much more completely. The vaporization style laser procedures can be especially helpful for men who are on blood thinners or have a higher bleeding risk because the laser helps control bleeding as it works. Recovery can be quite good, but irritative urinary symptoms may linger for a while as the tissue heals. More advanced laser enucleation procedures, by contrast, are among the most durable treatments we have and can treat very large prostates effectively without an abdominal incision. These operations require significant surgical skill and experience. They are not procedures you want done by someone who only does them occasionally. In the right hands, they are powerful, durable, and extremely effective. In less experienced hands, the learning curve matters. Finally, for the very largest glands or in men who need another operation performed at the same time, a robotic simple prostatectomy may be the best fit. Despite the intimidating name, it is not the same as removing the entire prostate for cancer. Instead, it removes the inner obstructing portion while leaving the outer capsule behind. This is a bigger operation than the endoscopic procedures, so recovery takes longer and the catheter stays in longer. But it can be highly effective for men with very large prostates or very complex anatomy. When someone has a gland so large that other options become less practical or less durable, this may be the cleanest and most definitive path. So how does a patient sort through all of this? The answer is not by searching for the best procedure in the abstract, because there is no single winner. The right choice depends on what kind of prostate is being treated, what kind of body is carrying it, and what kind of life the patient wants to get back to. In the final chapter, we'll bring all of that together and talk about how men can think through these decisions in a practical way, balancing durability, recovery, side effects, sexual priorities, and overall health so the treatment actually fits the person, not just the diagnosis. By the time a man reaches the point of considering a procedure for an enlarged prostate, he is often carrying more than just physical symptoms. There is usually a history behind the decision, months or years of disrupted sleep, frustration in public spaces, quiet embarrassment, or the gradual realization that something as simple as urinating has become a constant source of stress. That emotional weight matters just as much as the medical details when it comes to choosing the right path forward. The most important thing to understand is that there is no universal, best treatment. There is only the treatment that best fits you. That distinction changes the entire conversation. Instead of asking which procedure is most advanced or most popular, the more useful question becomes, which option aligns with my priorities, my health, and the way I want to live? For some men, speed of recovery is the top concern. They may have work responsibilities, family obligations, or simply a preference for avoiding downtime. In these cases, minimally invasive options can be very appealing. These procedures often allow a quicker return to daily activities and may avoid a hospital stay altogether. But with that convenience comes an important trade-off. Some of these options may take longer to show full benefit, and some carry a higher chance that additional treatment might be needed in the future. For a man who values convenience and flexibility, that trade-off may feel completely reasonable. For someone else, it may not. Other men are less concerned about short-term recovery and more focused on long-term durability. They want a solution that is as definitive as possible, even if it means undergoing a more involved procedure. For them, traditional surgeries or more comprehensive techniques may offer peace of mind. These approaches tend to have stronger and longer lasting results, but they also come with a longer recovery period and a higher likelihood of certain side effects, particularly changes in ejaculation. That brings us to one of the most personal parts of this decision's sexual function. Many men are not fully aware of how different procedures can affect ejaculation until the conversation happens late in the process. For some, this change is not a major concern. They are primarily focused on improving their urinary symptoms and quality of life. For others, the idea of losing the sensation of ejaculation is deeply important and influences their decision significantly. Neither perspective is right or wrong. What matters is that the decision is informed and aligned with what feels meaningful to the individual. Health status also plays a critical role. A younger, otherwise healthy man may be able to safely undergo a wider range of procedures, including those that require anesthesia. An older man with heart conditions, lung disease, or other medical issues may benefit from a less invasive approach that minimizes risk. Similarly, Men who take blood thinners may need to consider options that reduce bleeding risk or avoid stopping important medications. These are not small details. They are central to choosing a safe and appropriate treatment. Another factor that often goes unrecognized is how long the bladder has been under strain. When the prostate blocks urine flow over many years, the bladder adapts. It may become thicker, more irritable, or in some cases weaker. This means that even after the obstruction is removed, symptoms may not disappear overnight. Some men notice immediate relief, while others require time for the bladder to recover. Understanding this beforehand helps prevent disappointment and sets more realistic expectations. This is why a thoughtful discussion with a knowledgeable and experienced clinician is so important. A good consultation is not just about listing procedures. It is about asking the right questions. What is the size and shape of the prostate? How severe are the symptoms? What are the patient's priorities regarding recovery, durability, and sexual function? What medical conditions might influence safety? How comfortable is the surgeon with each option? These conversations should feel collaborative, not rushed. It is also reasonable for patients to ask their doctor about experience. Every procedure has a learning curve, and outcomes tend to be better when the surgeon performs that specific technique regularly. Confidence and familiarity matter, not just for the procedure itself, but for managing any unexpected challenges that may arise. If a patient does not feel comfortable with the answers they are receiving, seeking a second opinion is not only acceptable but often helpful. Beyond the technical details, there is an emotional shift that happens when men move from enduring symptoms to actively addressing them. Many describe a sense of relief simply from understanding their options. Others feel a renewed sense of control, realizing that they are no longer limited to living around their bladder. And after treatment, the changes can be profound. Sleeping through the night without interruption, leaving the house without anxiety about bathroom access, sitting through a meeting or a long drive without distraction. These are not small improvements. They represent a return to normalcy that many men had quietly lost. It is also worth remembering that improvement does not always mean perfection. Some men will still notice occasional urgency or frequency, especially early in recovery. Others may take time to fully appreciate the benefits as their bodies adjust. Healing is a process, and patience plays an important role in how that process unfolds. At its core, the treatment of an enlarged prostate is about restoring quality of life. It is about giving men back the ability to move through their day without constant interruption, to sleep without disruption, and to feel comfortable in their own bodies again. The wide range of available treatments is not a burden, but an opportunity. It allows care to be tailored, thoughtful, and individualized. If there is one message to carry forward, it is this: you do not have to accept these symptoms as an inevitable part of aging. There are effective, well-studied, and increasingly refined options available. The key is to approach the decision with clarity, ask the questions that matter to you, and choose a path that fits not just your prostate, but your life. When that alignment happens, when the treatment matches the person, the results can be transformative, not just physically, but emotionally as well. And that is ultimately the goal of good medicine, not just to treat a condition, but to restore comfort, confidence, and a sense of ease in everyday living.